The plot thickens in Pennsylvania's Democratic Senate primary race.
The lead shrinks for the incumbent as the debate over health care takes center stage. We go to our Bruce Gordon for the numbers and the story. Bruce.
Yeah, Thomas and Carrie Lee, brand new Rasmussen Reports polling shows Arlen Specter leading Joe Sestak by 13 percentage points, 47 to 34, among likely Democratic primary voters. Just 2 months ago, that Specter margin was 19 percentage points. So what's happened in the meantime? The health care debate. Senator Specter jeered at a state college town hall meeting this morning, and it's not the first time it's happened.
You want to be let out of here, you're welcome to go.
Senator Specter's town hall meeting in Lebanon Tuesday featured more of the same.
Now, wait a minute.
A lawmaker who generally supports health care reform trying to explain its benefits.
If you like your policy, you can keep it.
To skeptical, even angry crowds who are not buying what the federal government is selling.
I'm sick of the lies. I don't like being lied to. I don't like being lied about.
Specter's Senate primary challenger Joe Sestak has hosted his own health care meetings and has seen tempers flare, especially among those who already have coverage with which they're generally satisfied.
The biggest thing I saw out there is, I've got something. I can't afford to lose it. What are you doing? There is angst and anxiety across the board. Government, you haven't been accountable the last decade. Why now? Can I trust you?
The Obama administration has set up a website, whitehouse.gov/realitycheck, to fight back against myths and misinterpretations, like the claim that the proposed legislation would allow the government to push sick seniors into assisted suicide. Not true, says the director of the President's Domestic Policy Council.
This provision will allow people to access information about getting a living will. There's absolutely nothing mandatory about this.
Sestak wonders whether those with insurance coverage realize they are already paying hundreds of dollars a year extra to cover hospital care for those without insurance.
We have to understand that this is the right thing to do to cover everyone, but it's also the correct thing to do for the pocketbook. And that type of argument hasn't been made well enough.
This health care debate will almost certainly drag into the fall. The House is considering several bills. The Senate has nothing on paper, at least not yet. How each candidate handles the pressures of those angry crowds may determine who wins next year's Senate primary and maybe even the general election. More on that tomorrow. Carrie Lee?
Looking forward to it.